This
Centers, what
conference
you're
will
saying.
now be recorded.
Okay, so yeah, thanks for having me. I'll get started shortly. I'm with the Fire Paramedic Service, specifically the EMS division. And I'll take up about, I guess, about an hour of your time. I think last time was maybe around 50 minutes or something. So I won't be super long. If you folks have any questions, I'll try and have my chat open. I'm by no means the most tech savvy guy, but I can certainly keep that open for you. And any questions at the end, just fire away, and I'm happy to engage you in that way. So yeah, we'll talk about lots of different topics today. Injury prevention being the biggest for sure. Some common tripping hazards that we're seeing in our community, and some information really more about who we are. It's a bit of a mystery about sort of what we do as paramedics, and hopefully I'll clear up some of that for you guys. So before I get started, I always will start talking about myself just a little bit. I'm not going to go on and on. I've been in the business of EMS for about 24 years now, which I cannot believe. I started when I was 10 years old, which normally you would laugh if I'm actually with human beings, because that's funny. I've been doing this a long time. I was on an ambulance as a paramedic for a number of years. I promoted into our 911 center as a supervisor, and I moved into this role as paramedic public education coordinator about 5 or 6 years ago. So that's kind of my history. And I certainly miss seeing people in person. It's not the same doing these virtually, but I am grateful for the invite again. So let's get started. I'm just going to click on my screen here. Okay. So when we talk about EMS in the city of Winnipeg, we're called the Winnipeg Fire Paramedic Service. We still have two distinct divisions, though. We have a fire department division, which deals with, obviously putting fires out and some other rescue operations, and our EMS side. We're a combined department where we have what's called primary care paramedics on every fire vehicle, which essentially means they can provide basic life support very quickly. There's a lot of them out in the city. And we have advanced care paramedics on every ambulance, or we try to have the advanced care paramedics on every ambulance. But what happens when you dial 911 in the city of Winnipeg is you'll speak to Winnipeg Police to start. And I think that's a pretty big point to make. A lot of people, when they need paramedics, they think magically when they call 911, they're going to speak to us directly, and you don't. Winnipeg Police will answer your phone call, and they'll determine what city service you need. If you need an ambulance, you get sent to our 911 center, where we have about 16 911 dispatchers working 24 hours a day, 7 days a week. And that's a lot bigger than what folks think. They think we have a couple of 911 operators sitting in an office. We have 16 because they answer about 250,000 phone calls each and every year. They're extraordinarily busy. And essentially their job is to triage your incident. So they'll ask you a big series of questions that are all scripted. And what that means is the dispatcher is actually looking at their monitor, and the questions they ask you have been all pre-scripted, which makes the process, I'm going to say, much easier. It streamlines it, and their job is to basically triage what your issue is. So remember, we respond to about 110,000 calls every year. Our department is extraordinarily busy. Over 90% of our calls for service are medical in nature. So the majority of our incidents are for anything from trauma-related injuries to really anything medical. 110,000 calls. We don't have 110,000 ambulances. So I'll talk more a little bit later about kind of what that process looks like, about the urgent calls for service, and then we'll kind of work our way down the list. So it's ultimately up to the computer system, the dispatcher and the supervisor to determine what resources will respond to your incident. It's not up to the public. We still get 911 calls saying, I need the ambulance, but tell them not to turn their lights and siren on. That's not how that works for us. So the system will predetermine what resources head out. And again, I'm asked all the time, why do you send fire trucks to medical calls? They respond to approximately 40% of calls for service. And again, the reason being is the ambulances are just that busy. They're not as available as we would always like them to be. In a perfect world, we have an ambulance with an advanced care paramedic on every street corner. That just does not happen. The response we offer is very quick. And that's why a paramedic is on a fire truck. They can at least start their basic life support care while they wait for the ambulance to respond. We do a really good job of getting to our patients quickly, but I'd be lying if I said the ambulance can be right at your door within 1, 2, or 3 minutes. Sometimes they can be, but the demand for service is exceeding the number of units that we have currently on our street. It doesn't mean that your care will be per se delayed or limited. We try and manage a big demand for service with a select number of vehicles. So sometimes when you call for a non-urgent issue, that's why you may be waiting for some time, okay? I can tell you our advanced care paramedics on ambulances, that's about a 4 or 5 year program. They go to school for an extremely long time, and they basically bring the ER right to your home. There's not much that a paramedic on one of our ambulances can't do. We have medical supervisors. They're basically in a non-transport vehicle, and we have 4 supervisors that essentially roam around the entire city. They really specialize in dealing with newborns and children. So they're a pediatric specialist where they deal with kids. They can back up our regular ambulance crews. I can tell you children are not fun to work on. Those calls tend to be high stress calls, and how you manage a little newborn munchkin or a child is very, very different from somebody that's a big adult. So we send these supervisors for extra training, and they'll manage kids. The future of paramedicine, or the future of EMS in the world, I would say, is community-based medicine. So we have what's called community paramedics. And essentially these paramedics are advanced care paramedics that are embedded in the community. They can respond to incidents. They never transport you to the hospital. They can assess you, they can diagnose you, they can medicate you, they can treat you, they can suture wounds, and they can set you up with a specialist. That's the future of what we do, because taking everybody to a hospital is not always the best answer, okay? Lastly, we have tactical paramedics. This portion is just to make you aware that we're much bigger than just having a paramedic on an ambulance. Tactical paramedics are embedded with Winnipeg Police Tactical Team. That program has been around for some time. And essentially, our tactical paramedics wear all black uniforms. They're tactically trained, and they're embedded with that TAC team. So if there's a high-risk warrant call, a hostage call, a gun call, whatever they're dealing with, there's 2 paramedics that are embedded with that police team. We started doing that, I'll say, maybe around 10 years ago. There was a shooting in Winnipeg on Jubilee. It made the news, obviously, and a couple of police officers were shot. And to be blunt, the ambulance was 4 or 5 blocks down the street, because that's how we used to operate. If there's a gun call or high risk warrant, the paramedics are far away. And that didn't work so well. So now we'll actually essentially kick the door in with that police team. And of course, we're part of the big, system of healthcare. We don't transport everybody to the hospital, but if you need transport, that's obviously what we do. Okay, that's kind of who we are. It gives you a bit of a snapshot of who we are and what we look like. I keep losing my screen, so I can't look at you guys. I don't like that. There you are. So normally when I would talk to groups, I look at the group and I say, is anybody deaf, hard of hearing, or nonverbal? And I can only see a few of you. What I need you to know is if you're deaf, hard of hearing, or nonverbal, you have the ability to sign up with your cell phone provider, and you can actually text message to 911. Absolutely amazing. And what that does was that really will allow folks with a communication barrier, whatever that is, to access 911. I won't get into this in great detail, but essentially you sign up with your cell phone provider company, and they'll install, I guess, the information on your cell phone. You still dial 911, but that's a screenshot of what we look at. So if a deaf, hard of hearing, or nonverbal person accesses 911, this screen pops up for us, and the dispatcher will literally text message you back and forth. Pretty amazing program. And that could evolve into something bigger. Perhaps if you call 911 and you can't make a sound because perhaps you're in danger, or there's something criminal going on, you don't have to make a sound. You can just text us directly. Okay. So it says bonus round. It's kind of your opportunity for you to get involved. What I want to talk about today is an issue that costs Canadians about $8.7 billion per year. It causes over 4,000 deaths a year, and it causes 52% of the admissions to hospitals, and over almost 1.1 million ER visits every year. And what I do is I usually ask the group, what do you think causes this issue in our country? It's one type of incident. I don't know if you folks can chime in or, yeah, go ahead.
I'm gonna say falls.
You got the bonus question. Yes, thank you. So definitely the answer is falls. And I just want you to kind of study some of those numbers just for a quick moment. It's something that we don't talk about. It's not, what I usually say is falls aren't very sexy. And what that means is it's not the big ones. It doesn't minimize the importance of heart attack, stroke, cancer, diabetes, renal disease, car accidents, and trauma. It's just not talked about like the other ones. But the reality is the effects on falls in our society is one of the biggest costs out there. And money is not the only thing that matters here. When a senior has a fall, it's often the start of their rapid decline. We've all seen it. So the whole goal of this presentation is to make you aware of common tripping hazards and keep you upright so you're not falling. We all know folks that have had a fall and their decline starts very quickly. It happened to my grandmother. Bless her soul. She was a very young and able, healthy grandmother. I think if I remember around 74, 75 years old. Golfed just about every day. She had a fall at home and fractured her hip, and she declined unbelievably quickly. She ended up being paneled for a nursing home, and she had unfortunately passed away within about 9 months. That's an extremely typical story, so you really have to take falling serious, and I'll hopefully give you some good tips today to prevent you and keep you up on your feet. So kind of a cute picture. I grew up in Churchill, Manitoba. As a young boy, I spent many years there growing up, so I used to live with these polar bears. They would knock on my door at night, and a lot of people think that our falls are happening outside. We live in Manitoba, we have lots of winter, lots of snow and ice. We do have falls that happen outside, but the vast majority of your falls are happening in the safety of your home, where you think these are never happening. So I'll give you lots of different stories and show you lots of pictures and lots of different kind of tripping hazard tools that you can hopefully use for yourself. So again, please don't think the vast majority of our falls are happening outside. They are simply not. We respond to about 10,000 falls in Winnipeg every single year. 10,000. And there's a lot of different agencies and groups that are trying to work to get that number down. But in my time, in my career, which has been quite some time, those numbers continue to trend upwards every single year. We respond to more and more fall calls. It's not a secret that our population is certainly aging, which would be a big reason why we're seeing more and more falls. So we'll talk about some common reasons why we're seeing falls out in our city. So I asked everybody, do you do or take part in a regular program of exercise? And usually I'll maybe see some folks will maybe put their hand up. The reason why I have this there is you have to remember you want to build yourself as strong as you can possibly be. That does a few important things. Of course, it builds strength. It also will increase your core strength. Increasing your core strength will also increase your balance. And remember, if you build your body as strong as you can make it, you'll be able to absorb the impact of a fall greater than simply doing nothing. You don't have to go to the gym with me and bench press 200 pounds. Exercising can be something as simple as going for a walk, doing some stretching. If you can use the stairs, if you're physically able to use stairs, do that. I know we live in Manitoba and things are very different with COVID. I'm not going to talk about COVID today. I used to tell people if you can go to the mall and use the mall as an area to do walks, do that. Things have changed now, and I realize that. The whole thing is about keep your blood moving. If you live a very stagnant lifestyle and you're sedentary, you're more prone to developing blood clots in your legs, which those could break off and travel to your brain and cause a stroke. And your blood pressure could elevate. So it's all about keeping your body active, okay? Keep losing my little arrow here. Medical checkups. That's a picture of the community paramedics that I talked about. I can't stress enough how important it is to seek your family physician for that checkup at least once a year. We still encounter multiple patients every year that haven't seen their family physician in 5, 10, 15, 20 years. And that's scary. They say, there's nothing wrong with me. Why would I go and see my doctor? And the whole premise of that is for your physician to catch disease processes before it's too late. A lot of diseases and illnesses don't have an outward symptom until it's too late. You're not going to know that your blood pressure is creeping up or your blood sugar is maybe going up. You're not going to know that you have some symptoms of heart disease or renal disease or whatever's going on until it's too late. You go into your family doctor once a year at least to say hi. He or she will give you a physical, check you up, and hopefully catch these things early. So don't wait until you have a screaming issue to seek care. Go in once a year and say hi. I always say with our vehicles, we're very good. If we buy a nice new fancy shiny vehicle, we follow the maintenance to a T. We take it for oil changes. If you hear a noise, you immediately go to the garage and say there's something wrong with my car. We don't do that with our bodies. A pretty pointed story that I tell was an incident that I responded to years ago for a middle-aged man that was at home, and sadly he was dying. He was diagnosed with a type of throat cancer that would have been extremely treatable if he had caught it early. And I still remember him looking at me and saying, I've had these symptoms for over 5 years and I didn't do anything about it because I was too busy. Said I was too busy with work, too busy with my kids. I just kept putting it off, and he ended up dying. That's a pretty strong story. I'm not going to say that that's perhaps your future, but that's really tragic. That's something that he could have prevented if he just would have, got his butt in there and had himself looked at. So please don't wait until you have a big issue. Taking medications as prescribed. This one seems pretty straightforward. But as paramedics, we're still seeing patients in the community that are prescribed a medication. As soon as they start feeling better, they stop taking it. Please do not stop taking your medication unless you're directed to do so. You're on your medication regime for a reason, and follow the instructions of your doctor. If you have any questions about your any drugs or medications that you're on, your pharmacist is an excellent person to go to. Make sure you know why you're taking all the medications that you're on. You'd be surprised how many of our patients in the community give us a big shopping bag of medication that they're on and they don't have a clue why they're taking it. Make sure you understand why you're taking what you're taking, and be careful about mixing things. Even if you do natural remedies or herbal remedies, those can counteract with some of the modern medications that you're taking and actually be dangerous. There's an antihypertensive medication on the market. Some of you may be on it. And if you eat something as simple as grapefruit or drink grapefruit juice, it cancels the effect of that medication without you knowing. So talk to your pharmacist about anything that you're doing naturally, even just vitamins. Okay, make sure you have that chat with them. We'll talk about tripping hazards right now. Again, I can only see a few of you, but just ask yourself, do you have a flashlight by your bed? Maybe do you have night lights set up? And I encourage you to have both of these. The flashlight, the biggest reason is if your power goes out, you have that backup light source to use. There was a building downtown that we responded to 2 or 3 years ago. and I want to say it was at least 20 stories high, and it was full of seniors. Their main power failed and their backup generator failed as well. So we had seniors that were trying to navigate down their stairwell in absolute darkness, and a whole bunch of them were falling down the stairs, obviously. So you can have that flashlight as a backup light source. You can get motion sensing night lights. There's a picture of one right there that actually senses motion. So if you get up at nighttime, and I have to tell you, that's when most of our falls happen. Most of our falls are happening in the middle of the night where folks are getting up and they have to go to the bathroom, and they're falling between bed and bathroom. If you're a frequent riser at night to go to the bathroom, make sure you have a clear path. Don't leave your slippers or house coat, or make sure your cat's not sleeping by your bed, and get those motion sensing night lights. They magically turn on and they turn off after about 30 seconds or so. Again, I want you to keep that in mind. I would probably say anecdotally, of our 10,000 falls, I would be confident in saying 60 to 70% of those happen at night, getting out of bed. Okay. Bathrooms are one of the worst places you can fall. And the reason why I say that is, what does a bathroom have? It has a hard bathtub, a hard floor, a hard toilet, a hard counter, and hard plumbing fixtures sticking out of the wall. We see a lot of head injury falls from a simple slip and fall. The biggest thing you can take from today is, please get a proper bath mat. The number of people we see that have an improper bath mat is just staggering. They use a chunk of carpet or like an old towel. And when they step out of the bathtub, they fall down. You have to get a slip resistant bath mat that has a rubber bottom and something that's able to absorb the water, so you're not leaving spills everywhere. A ton of our falls are happening getting out of the bathtub or shower. If you need some assistance getting in or dealing with actually taking a shower, get the assist bars before you have your incident. A lot of people will only affect change, and what I mean by that is they'll wait till they have a fall to affect change. They'll say, well, now I've had a fall, I should probably put some grab bars in. Be proactive and consider getting those before you have a fall, please. Okay. Again, if that's the one thing that you can go out and spend a little bit more money on, get a proper bath mat. Healthy food choices. This one seems pretty straightforward, but what we're encountering is a lot of seniors are relying on processed or frozen meals. And you have to remember, you have to incorporate some fresh fruits and vegetables and fresh food. The reason why we say that is, if you're eating a lot of processed food or microwavable food that has a shelf life of 30 years, that's packed with sodium. There's a lot of fat content and it's packed with sodium. And what does sodium do? It puts strain on your heart and your kidneys, and it elevates your blood pressure. And what we're seeing is a lot of our falls are caused by folks becoming dizzy because their blood pressure has been elevated for some time. If you sustain a high blood pressure, it will make you dizzy, lightheaded, and you have a more higher chance of falling. So please don't rely on your microwave for all of your meals. Okay. Staying hydrated. Back in the day, they used to say you have to drink 60 gallons of water a day or something crazy, and that's not the case now. They still say approximately 5 glasses of water a day. Some research is suggesting that up to 90% of seniors are chronically dehydrated. And what that does to your system, it puts a lot of strain on it. It will again make you lightheaded and dizzy and more prone to falling. And you'll be surprised how lethargic you can be. If you're chronically dehydrated, you'll be extremely tired, kind of run down. You have to incorporate water. Coffee, milk, juice, and tea count as fluid intake, but coffee and tea and alcohol is a diuretic, which will make you pee more, which will further dehydrate you. So you have to incorporate water. If you're a fan of coffee and tea and maybe the odd beverage of alcohol, that's fine, but try and stagger that with a big glass of water. So please make sure you're drinking water throughout the day. Proper footwear, some walking devices as well. The picture of the purple stilettos would not be really smart footwear. Make sure you're wearing proper fitting, slip resistant footwear. We're seeing a lot of people that are falling because they're wearing sometimes sandals or Crocs. Please be careful with those. Those can be, tripping hazards for sure. If you use a walker, make sure you know how to use that device. A lot of people use their walker as a chair or as a means to get up. So they'll put their hands on their handles and they'll push themselves up, and that's okay. But you have to be comfortable using the braking system. And we're seeing a lot of folks in the community with a walker don't know how to operate these things. So they go to use it as a chair, or they push themselves up without the brakes being activated. The walker shoots down the street, and the poor patient will fall next to their walker. You can get a cane. Obviously, if you use a cane, have a rubber stopper on the bottom of it for the summertime. And there's a little flip over spike you can get on the bottom of your cane during the winter time to dig into the ice. I'm going to hold up a picture of a sort of a set of slip over shoe spikes. These are fantastic. If you find that you're active during the winter, that's great. But be careful as you navigate. Obviously, spring is here now, but we do have some falls outside because of the amount of snow and the amount of ice that we get. The slip over spikes are fantastic for digging into the ice. If you do venture out in the winter time, and I would even suggest any time of the year, and you're prone to falls or you have a concerning medical history, consider going for a walk with somebody else, or at a minimum, try and bring your cell phone. Even go a step further and say, maybe if you're prone to falls, reach out to your neighbor or your family and say, you know what, I'm going out for a walk. This is where I'm going. Tell them what the route is going to be. And I should be home in whatever it is, 20, 30, 40 minutes, and perhaps check on me to make sure that I, got back okay. Every winter, I can tell you, we have a handful of people that fall down in behind a snowbank that's 3, 4, 5 feet tall. And if you can't call for help, nobody's going to see you. We do have a handful of those every single year. If you fall behind a snowbank, people will drive by you all day long. So please consider a group or bring your cell phone. Stairwells, this may not be pertinent for some of you. I obviously don't know where you folks live, but if you do have a staircase, I encourage you to use the stairs if you're physically able to do so. It's a source of exercise and it gets that blood moving. Make sure you have a working stair rail. And what I can tell you about the picture you can see on the bottom, there's a picture of a sort of a puckered section of carpeting. That was taken from a home that we responded to. It was, I always say, quote, a normal family. They were engaged and loving, and they had the elderly grandmother living with them. That picture is up on the second floor or the second story of this house. They accepted they had that tripping hazard. They did nothing about it. They accepted you have to step over that rolled up carpet every single time. The problem is at the bottom of that picture is the stairs going down to the main floor. The family in that incident had left for the weekend. They left the grandmother home alone, which was quite normal. She was very able and capable. They came home after the weekend and found her on the bottom of the stairs. She ended up tripping on that tripping hazard and went down the stairs, and she did not fare well. That's tragic because that's a preventable incident that should have been prevented. You don't accept your tripping hazards, you immediately fix them. It's another example. You don't wait until you have the incident, you be proactive and you get rid of these hazards. That's a pretty common picture. That's like an entry floor mat. This was taken in a school, and these are very, very dangerous. You can see how the edges are kind of rolled up or puckered up. You're going to catch your toes on that, your walker, maybe your cane. This was a young boy that fell on this. He didn't have a critical injury, but he extended his wrist and he fractured his wrist when he fell down on that mat. So just be aware that these are out there and they're notorious for being rolled up. So be careful you're not going to catch your feet or your walker on those. Kind of an interesting one here on the top is a hardwood kitchen and a carpet living room. And you can see their transition strip was about 1.5 inches high. So they had their carpet on the bottom. They had about 1.5 inches transition strip of wood, and they run all of their extension cords all the way across their hallway. That's just a disaster waiting to happen. This was quite sad. The gal that fell here was young, and when I say young, I'm trying to remember if she was between, I want to say 68 and 72-ish, which nowadays is young. She finally tripped on those cords. She fractured her hip. She went from a very capable, active young lady to a nursing home. She deteriorated so quickly after the hip fracture. She was paneled for a nursing home, I think, after surgery within about 6 months. So again, that's a preventable incident. I can tell you almost every fall call we respond to is absolutely preventable. Some of them aren't, but most of them are. Okay. I always say there's no way this is a city Winnipeg sidewalk. We all know that this is out there. I encourage you to be active, but just know where you're walking. Know there's some cracked sidewalks and there's some sections that are going to be puckered up as well. Don't use your stairs as like a storage shelf. You should never have anything stored on your stairs. Books, cats, laundry, books, newspapers, or whatever you have. Keep them clear. And thankfully, we're sort of past this season for now. But keep your walkways free of snow and ice. It keeps you safer. And at the end of the day, it makes the paramedics gaining access to you quicker. I can't stress enough how many residents I've been to in my career where we pull up to the scene, there's a 4-foot snowbank and there's 2 or 3 feet of snow all the way into the house. We're certainly still going to get to you, but it'll take us a little bit longer. So please keep those clear. That's a picture of hoarding. The reason why I have this in there, we have probably about 4 dozen of these addresses flagged in our system. And essentially what we can do is we can notify the paramedics or the firefighters if there's a fire issue that this is what you're going to see. It's dangerous and it's no way for folks to live. I always say if you live like this, it's usually not just a matter of somebody being lazy. There's a mental health component that's often with this. Make sure that you get the help you need. There's certainly good folks out there that'll give you some help. Okay, I'm going to switch and talk about the K.R.I.K program. I don't know if you folks need K.R.I.K kits. I can chat to you later on. I just got a supply of about 400, so I can certainly give you a few more if you need. The K.R.I.K program was developed, I think around 98 or 1999. It's been around for a really long time. It's emergency response information kit. And essentially it's a packet of information that the paramedics can access. It gives us your everything, your medical history, medications, allergies, your next of kin, lots of information that we can access. It helps the paramedics. It focuses the assessment that they have to do for you. And it just kind of paints a bit of a bigger picture for us. The kits are typically for free and you attach them to your fridge. They have 2 little magnets and they get stuck on your fridge. So I always say if you see the paramedics heading to your fridge, they're not hungry, they're looking for your kit. Maybe they are hungry, I don't know. So who can help you? If you need help filling these kits out, there's lots of help. Obviously anything from families to relatives to family doctors, senior resource council members, there's lots of help that we have here present. There's always folks that are willing to give you a hand if you need help filling out the information. The kit has a brochure, a health and medication form, a healthcare directive, and a door sticker. The kit is in both French and English. Just flip it over and there's a section in French. If you prefer to speak French or you prefer to have perhaps a crew that speaks French, which is not always possible, you can actually get essentially a Francophone sticker that you can attach to your K.R.I.K kit, or you can put that on your door that signals to the paramedics, I'm a French speaking person, okay? So everybody has a purple health card. You can transfer the information from your health card onto the kit. A little secret, you don't have to bring your health card to the hospital. The hospital loves having these. They do not require them. These have a tendency to get lost. And if the information is transferred onto the paramedic's computer, they magically transfer that right to the hospital. So you don't have to bring these to you. Just copy the information onto the kit. Organ donation, often a lot of folks don't like talking about this. It means that you've passed away. It's awkward, I get it. People don't like talking about death, but I encourage you to sign up to donate organs. You don't have to be a healthy young athlete to do so. The oldest organ donor that I know to date was over 90 years old, 90. Leave it up to the organ donation experts to determine what they can use. They want you to go online and utilize the signupforlife.ca. There's still a very small percentage of Canadians that volunteer to donate organs, and that's sad. What I can tell you in my career, I always say, I don't know how much death I've seen. It's been a long time, and it's palpable for two reasons. It leaves a little less heartache when you know your loved one is able to give the gift of life. Trust me, I've seen it a lot. That sting hurts a little bit less. One example I always like to give was a fatality that I had responded to some years ago. It was a fairly young man, and he was able to donate parts of his eyes so a 6-year-old boy could see. That's amazing. If that does not affect you, you're not human. And working with the family, I was literally able to see the absolute devastation, obviously, that they were going through, but the fact that they were able to see their loved one donate what they could to this little boy was just an absolute miracle. So please consider that and have that conversation with your family. Medications, obviously it lists the medications you're on, why you're taking them, how much, how often, and so forth. I can tell you this, that our paramedics should and will know the reason why you're taking the medications you're on, but it drives the point home when you write the reason why you're taking your medication, it forces you to know why you're taking them, and that is vital. You have to be part of your healthcare plan. And part of that is knowing why you're taking the pills that you're on. You don't have to write these out. The actual medication themselves, you can go to your pharmacist and he or she will give you a printout of all the medications that you're on, and you can just have that either glued, taped, or stapled to the kit themselves, pardon me. Over time, people change medications. I've seen K.R.I.K kits that are full of whiteout and they're just a mess. Don't be shy to throw that sheet away and go to your pharmacist and get a nice printout. You have to remember, a lot of the medications or a lot of the treatments that we're providing in the back of an ambulance is sometimes based on the current medications that you're taking. It won't, if we don't have access to your K.R.I.K kit, you're still going to get excellent treatment from us. This makes it a lot easier. A prime example was when I responded to a call when I was still doing the shift work in the middle of the night for a lady that was extremely sick. And I was going to treat her. It was a fairly easy thing to treat for us. I remember I looked at her K.R.I.K kit and I said, oh, I can see you're taking 40 milligrams of a drug called Lasix. And she says, oh, no, dear, I haven't taken that in 10 years. But it was still showing on her K.R.I.K kit. And my treatment would have been altered by her current medication list. So keep them up to date, please. Okay. Pardon me. We obviously want to know illnesses, any surgeries you've had, or any allergies. Those ones are pretty straightforward. And you have to remember what this does is this focuses the assessment, and it also assists us in taking you to the right hospital. And what that means is there are certain hospitals in Winnipeg that deal with specific issues. So if it's a major trauma, we have a hospital that deals with trauma. If you're having a stroke or a heart attack, we have a vascular hospital. If you have a fractured bone, we take you to a rotating schedule. So what I'm trying to say is there's specific hospitals that are best to take you to for the issue that you're having. What that does is that stops the necessary transfer after. If we take you to a peripheral hospital, sometimes we may have to transfer you later on, and it just kind of saves that trip. Healthcare directive, again, I can't see you guys, but just ask yourself if you know what a healthcare directive is, or some people call them living wills. The K.R.I.K package does have these in it, and essentially this is a legal document that dictates what your healthcare wishes are in the case you've passed away or you're critically ill. It's a legal document that we have to follow, and you have the right to dictate what you want and what you don't want. So a prime example is there's some folks out there that don't want to be sent to a unit in a hospital where they have a breathing tube. They don't want CPR. They don't want certain medications, perhaps. That's your right to dictate to us, and we have to follow that legal document. The biggest caveat here is we have to have the physical paper to honor what your wishes are. It's not good enough if your family member, friend, or neighbor says, oh, stop what you're doing. They wouldn't want this. We have to see the legal document to honor what your wishes are. If you don't have a plan, if you don't have a healthcare directive, you haven't talked to your family, I'll be gentle. I used to say shame on us, because what you're doing is you're leaving those terrible, awkward, very tragic decisions to your children or to your family to make. That's an absolute tragedy. Do not do that to your family. I've had that discussion with my own parents, and they do have a plan. I don't like talking about it, but why would you want to leave that to your family? You can take care of those decisions ahead of time so you're not leaving your family with those choices. The number of, again, I'll go back to it, the number of fatalities or the amount of death I've seen in 24 years, I can tell you it's palpable when somebody has a plan versus somebody that does not have a plan. That tension and that heartache is palpable if they don't have a plan, because then we and the other healthcare team members are looking at your kids or your loved ones to say, what would you like to do? That's not fair. Have that decision, write it out, and now you're golden, okay? Find my arrow again. Power of attorney, I'm not a lawyer, but it's just a good reminder. Power of attorneys, for the most part, deal with your finances. They deal with your millions of dollars. They don't make healthcare decisions. There's a couple of different types of power of attorney, but for the most part, they cannot make healthcare decisions. And I have this on here because we still see people in the community that say, oh, don't worry, I've got cousin Johnny who's my power of attorney. They can't make healthcare decisions for you. There's a big difference there. Okay, so the ERIC sticker goes on your door, and the ERIC kit itself gets hung on your fridge. We want to know who your family doctor is and your next of kin. Those ones are pretty obvious. We don't always transport you to where your family doctor has privileges to admit. We more often than not take you to the best facility for the complaint that you're having. Okay, so we'll switch gears. We don't have too much more to go, just a few more slides. I want to talk about the whole premise of EMS, paramedicine, 911 is emergencies. The whole premise of who I am and what we do as a department is to respond to emergencies, but we're still being utilized for a high number of incidents that are non-urgent. And I'm going to kind of work my way down the list. So urgent things that we want you to call us for, we want you to call 911 anytime you're having chest pain. And I wouldn't really worry about the lasting more than 2 minutes part. I'm probably going to dump that. I'm just going to say anytime you're experiencing chest pain, call 911. Our advanced care paramedics on ambulances have access to a on-call cardiologist at St. Boniface Hospital. It's an amazing program. If you're having an active heart attack in the community, we can get that clot busting medication into you within minutes. We'll then phone up the on-call doctor at St. Boniface. We will discuss your case with him or her. We bypass the ER and we take you right to surgery. It's an amazing program. Don't hesitate to call 911. Uncontrolled bleeding, sudden or severe pain, coughing or vomiting blood. Anytime you're short of breath, if it's an abnormal shortness of breath for you, we want you to call 911 very, very quickly. Sudden dizziness, weakness, change in vision, change in your mental status. It could be perhaps low blood sugar. You could be having a stroke. There could be a whole bunch of things that certainly could be causing that. Please phone us. Severe persistent vomiting or diarrhea. This one's a little bit, this one will throw some folks off. If you're having run-of-the-mill flu-like symptoms and vomiting, a little bit of diarrhea, you probably don't have to call 911. The key message here is severe or persistent. If you're acutely dehydrated, that's a medical emergency, and we want you to call us. It doesn't mean you even have to go to the hospital. You can work with the paramedics. Maybe they can give you some fluid, give you some medications, and make you feel better, and perhaps just leave you at home. Anytime you're having a baby. I'm probably going to say the group that I'm targeting today is not going to be having babies. But folks out in the community should not be doing this without help. If you have a midwife, that's fantastic. But babies have been delivered for thousands of years. They're usually very straightforward and very easy. It's the cases where something goes wrong where it can be really, really scary. So if you're having a baby, make sure you phone us or get some help that you need. Okay, if you do call 911, we ask that you don't move the person unless they're in imminent danger. We don't want to cause further injury to yourself or to the patient. There are still some incidents that we respond to where some well-intended neighbors or loved ones arrive and they try and pick their loved one off of the floor. Be careful doing that. We don't want you to hurt yourself and we don't want to injure the patient further. Don't give anybody anything by mouth, not even the magical glass of water. Water is well intended. I understand why people do it, but it does not fix anything. You're potentially creating a choking hazard by giving them the water. I responded to calls for an unconscious patient that somebody's cradling in their arms and they're dumping the magical glass of water down their throat. Don't do that. If you want to assist in the community, I'm not suggesting you thrust yourself into the community into an incident where you don't know what's happening. Our 911 dispatchers can tell you how to stop bleeding. They can tell you how to do CPR. They can tell you how to deliver a baby. You name it. They will walk you through what you have to do. Don't hesitate to help if you are familiar with the incident. If you do call 911, pretty straightforward stuff. We want you to speak calmly and clearly. Now that's pretty easy to tell somebody, just speak calmly and clearly. They've proven internationally in the 911 communications world, less than 1% are what we refer to as freak callers. And what that means is all we hear on the other line, the other end of the phone is just screaming. We can't access any of the information that we need from these folks. It's extremely rare. Our dispatchers are highly trained. They're trained to calm you down. So bear with me here. I just yanked my my little headset out. We have to know your address and your phone number, obviously, and we have to know why we're coming. We still see folks that call 911 and the message we get is send an ambulance and they hang up. That's not good enough. We have to determine what's happening and we have to attempt to determine that the scene is safe for our crews to really head to that address. It goes without saying, not everybody is perhaps forthcoming. So we're going to get the information from you that we need. If we can't determine the scene is safe, we will respond with police just to keep ourselves safer. Okay. If you call from a landline or a home phone, which seems to be becoming more rare and rare, our screen will automatically populate with who you are and your address. That's fantastic, but we're seeing most of our 911 calls are coming from a cell phone nowadays. And please remember, we don't have the infrastructure right now to determine exactly where you are if you call from a cell phone. So again, we have to know where we're coming. Okay, so we've already talked about issues that are urgent. It could be, again, things like heart attack, major trauma, severe head injuries, amputations, obviously, severe difficulty breathing or bleeding. Anytime a person is unconscious or in seizures, we want you to call 911. As we work our way down the list, some urgent issues that perhaps still need transport to the hospital, but we may take some time getting to you. That doesn't mean we don't care, doesn't mean we're off drinking coffee or hanging out down the street. We're having to navigate and triage those hundreds of calls for service. We have to determine which ones have to go immediately and perhaps which ones can wait. So if you're calling with a stable fracture, sprains, back pain, skin and wound issues, headaches and migraines, we will get to you, but there may be a slight delay because those are going to fall down the list for us. Doesn't mean they're not important or we don't care. We have to get to all the other urgent things first and foremost. I'm a guy that struggled with debilitating migraines for about the last 20 years. And if anybody does live through migraines, you'll understand they're horrific, but they're not a medical emergency. Once you're diagnosed and you appreciate what you have, it's not really a medical emergency. So we'll get to you, but there might be a little bit of a delay. Some issues that I would highly suggest are not best managed with calling 911. And I always premise this by saying the message is never, I'm never going to tell anybody don't call 911. Not a chance. If you're scared, you don't know what to do, you're by yourself, you're not sure if you should call 911, we do want you to call us and we will help you, but consider health links. If you have really minor issues, a common cold, a low-grade fever, minor cuts, bruises, bites, sore throat, sore ears, you've stubbed your toe, whatever minor non-acute issue you're having, or even if it's a non-acute chronic health issue, please call Health Links is one resource that we often direct folks to. I'm sorry, it's very dry. All the air kits that I provide to the community, I think I've got one in front of me with the number on, so I do. So the air kits I have in the community, this is what they look like. And I've just recently started to attach the Health Links number onto it. And I do that because we want you to access Health Links for your non-urgent issues. You're still going to get the help you need. You'll speak to a real live human being nurse and he or she will help determine what you should be doing. So if you call and say, you know what, I've had a low-grade fever for 2 days, I have a sore ear and my throat is sore. He or she will essentially triage your issue, and they'll actually very, very quickly and very well tell you what you should be doing. They'll either say, you know what, this is a problem where you should be calling 911, and they'll tell you to disconnect and call 911. Perhaps they'll say, go to a walk-in clinic, make an appointment with your family doctor, go to a quick care clinic. There's, I want to say, 2 or 3 urgent care centers in our city now. The whole premise is to keep non-acute patients out of the back of our ambulances and out of the back of the emergency room. The back of ambulances and the emergency rooms are often clogged with non-acute patients. And I appreciate sometimes you don't know what else to do and the message is never don't call or don't go, but ask yourself, it takes 2 seconds to say, is this a true emergency? Because when you remove an ambulance from service, you're removing their ability to respond to the emergent call. And to be candid, it's frustrating, and I've been there, where I'm tending to somebody that has had a bad cold for 2 weeks or a sore back for a month or whatever their non-acute issue is. It's not minimizing who that human is, but then when I hear on my radio down the street that there's a child hit by a car or somebody having a seizure or a heart attack or a stroke, and I can't respond to that urgent issue because I'm tied up with this non-urgent issue, that's frustrating. So we're trying to direct some of those folks to another resource that can certainly give you a hand, okay? I think perhaps one of the most memorable non-acute issues that I responded to years ago was for somebody in the summertime that had a bad mosquito bite that was really, really itchy. That's what we do. We help anybody that calls, but calling 911 and getting a paramedic for that is not the best resource, okay? That's kind of the formal presentation. I always say talk to your family and engage your community. Let's start talking. I specialize in substance use and street drug training. That's not what I'm here to talk about today. That's my forte. I've done some national work with that. And if you have grandkids or friends or families that you love, make sure you educate and talk about those issues that are on our street. It's pretty serious stuff out there. That last picture is a picture of our major incident response vehicle. I just kind of put that up there for fun. We have one of these vehicles that's stationed downtown. The premise of this is really to respond to the mass incidents, any confirmed potential multiple patients. This vehicle can respond. I think they can transport around 8 stretcher patients. So if you see this bus driving around, it's not going to take you shopping. This is not a transit bus. This will respond to incidents where there's lots of patients. So I just kind of like throwing that up there at the end. I often get asked, what is that bus that I sometimes see driving around? So there you go. That's it for me. Let me just get rid of the screen here. That's my formal presentation. If you folks do need any air kits, I'm happy to supply those. I've got a fair amount right now. And if there's any questions, fire away. I genuinely hope you've learned something. What I do ask is obviously can't come into your homes. I used to pop up and have a visit with some folks, but just simply go around your home. If you live in an apartment, a condo, a house, it doesn't matter. Go around the interior of your home, look for some of those tripping hazards that we talked about today, and fix them. Please don't wait until you have a fall. Okay.